One of the things we worked through with the City of Palo Alto in the planning of the buildings was to develop a building that was taller than the current standard height or height limit here on the Stanford campus, which is 50 feet. We have worked within that 50-foot limitation for the hospitals up until this time. And we've created a very extensive horizontal network here on the campus to try to deal with putting an international medical center in that very limited height, which from the standards of what floor heights are in hospitals, that's 3 floors tall. It has been extremely restrictive to us over time because we cannot separate our public experience from our service experience by floors, which most hospitals can do. It means we have circulation within our building that mixes our public and our staff and our patients. So you come into the main lobby at Stanford today and you will see patients on beds being wheeled from their room to the operating room. We just don't have the ability to deal with separation that you can do in a more vertical format. So we approached the city and said, can we look at providing a taller building on the campus to meet the needs of our more critical patients? And we had to do a series of meetings with the community and with the city to really describe what the hospital of the future is and why it was important to be able to do a taller building to develop that kind of a concept. So we really had an interesting organization to make this proposal work. We developed a plan that had a lower component of the building at 50 feet, which matched the height of the rest of the campus. And then we looked at placing another element, or almost a building on top of a building, that directly sat on top of that platform that served as our, what we call the hospitality component of our hospital, which is where the beds are. This also created a zone at 50 feet, which we call the garden zone of the hospital, which allows us, where that setback happens between the historic height and our new height of our building, we've created a series of roof gardens and roof pavilions that create a second zone for the public on our campus. But that is a different type of public. It's more private. It is much more patient-focused, and it's a much more serene environment because you don't have the day-to-day activities of the hustle and bustle of people coming in and out of the building, coming in and out of cars, vans, etc. So this garden level has become the key feature in the planning of our new building. The other piece of that feature is that there are no clinical functions on that floor. A very key initial principle is that is a floor for respite for both our patients and for our staff. And it is an area of education, it is an area of meditation, respite, and other activities that are all key pieces to how the hospital operates, but not direct patient care.